Good morning or good evening to all distinguished colleagues and professionals. I'm Muthia Ashifa. I'm currently working in one of the mining and energy company in Indonesia, and I'm also Indonesian Industrial Hygiene Association president. Today, I would like to bring forward an important approach in how we view workplace health and safety, specifically in the mining industry, where risks are traditionally seen through physical and environmental lenses. As reflected in this framework, industrial hygiene has long focused on controlling physical, chemical, and biological exposures. However, one critical dimension is increasingly recognized as equally important, which is psychological health and safety. This presentation discusses how we can systematically integrate psychological health into industrial hygiene framework, ensuring that we not only protect workers from visible hazards, but also from psychosocial risks that impact mental well-being, performance, and overall safety outcomes. Before we dive deeper, let's take a quick look of what we'll be covering in this session. I'll start with a brief overview of industrial hygiene to set the foundation and align our understanding. Then we'll explore the scope of industrial hygiene, specifically within the context of mining's operation. Next, we'll look at how industrial hygiene is managed in practice, what systems and approaches are typically used on the ground. From there, we move into the key topic, integrating psychosocial risks into industrial hygiene, expanding our perspective beyond traditional hazard control, and we'll also discuss some of the key challenges faced during implementation. And finally, we'll wrap up with practical intervention strategy to strengthen both physical and psychological health and safety. So let's get started. To begin, let's take a closer look at industrial hygiene. From OSHA, industrial hygiene is defined as both a science and an art, focused on the anticipation, recognition, evaluation, and control of environmental factors in the workplace. These factors can arise from daily work activities and have the potential to impact workers' health, well-being, and overall comfort. The goal of industrial hygiene is not only to prevent illness and injury, but also to ensure a safe and healthy working environment, both for workers and the surrounding community. This definition highlights a proactive approach, identifying risks early, assessing their impact, and implementing effective control before harms occurs. Building on the previous definition, the American Industrial Hygiene Association further expands our understanding of industrial hygiene. It is described as the science and art of anticipating, recognizing, evaluating, and controlling workplace environmental factors. These include not only the traditional hazards, but also psychological factors, which are increasingly recognized as critical to workers. Next, let's look at the concept of the working environment within industrial hygiene. The working environment is a key aspect of workplace hygiene. It includes a wide range of factors that we are already familiar with, but however, it also includes the psychosocial factors, which are often less visible but equally important. These factors such as workload work organization, and social interactions can significantly influence the safety and health of workers. As highlighted in the Ministry of Manpower Regulation, managing the work environment means addressing all these elements in an integrated way. This reinforced the need for a more comprehensive approach, ensuring that both physical and psychosocial risks are properly identified and controlled. The scope of industrial hygiene follows four key steps. First, it's anticipation, which is identifying potential hazards before they occur. Second is recognition, understanding the hazards present in the work environment. Third is evaluation, assessing their severity and potential impact. And finally, control, implementing measures to eliminate or minimize risk. In essence, industrial hygiene combines scientific principles and practical approach to ensure a safe and healthy workplace. Now let's explore how psychological risks are integrated into industrial hygiene. A psychologically healthy and safe workplace, also known as psychosocial safety, focuses on managing risks that can impact both mental and physical well-being. First, we have the psychosocial hazards. These are aspects of work, such as high job demands or harmful behaviors that have potential to cause harm. Next are psychosocial risks, which refer to the likelihood and severity of that harm if these hazards are not properly managed. And finally, psychological harm is the actual impact, which may include a condition such as burnout, anxiety, or even physical health issues. This approach helps us move beyond traditional safety towards a more holistic protections of our workers. Psychological health and safety align strongly with existing Indonesian regulatory frameworks and also international standards. Under Law Number 1, Year 1970, Occupational Safety, employers are required to protect the safety and health of workers in a holistic manner, which implicitly includes a mental and psychological aspect of work. And from Government Regulation Number 50, 2012, the implementation of Occupational Safety and Health Management System mandates systematic hazard identification, risk assessment, and control, also providing a clear mechanism to incorporate psychosocial hazards alongside physical risk. And within the mining sectors itself, related regulation already emphasize leadership accountability, risk management, and continuous improvement. In global standards, we can find the ISO 45001 and ISO 45003 that provides us specifically guidance on managing psychosocial risks. And for Indonesian mining organization to operate into this international standard, the psychological health and safety is therefore a natural extension of existing systems rather than a new compliances burden. Right. Anticipation is the first step in industrial hygiene process, and it involves proactively identifying potential hazard before they result in harm. For psychosocial hazard, anticipation requires looking beyond traditional hazard register and examining how work system may create psychological strain. This includes reviewing work schedules, staffing levels, production targets, organizational change initiatives, and leadership practices. Data sources such as incident reports, near-miss trends, overtime records, and fatigue-related events provide early warning signals of psychosocial risk. Workforce surveys and screening tools such as validated stress or psychosocial risk questionnaires can also be used to identify high-risk roles or departments. Importantly, anticipation should consider future changes such as increased production demands, automation, or organizational restructuring, which may introduce new psychosocial stressor. Recognition involves clearly identifying and describing hazards and exposure present in the workplace. For psychosocial hazard, this step requires translating work-related stressor into recognizable exposure categories that can be assessed and managed. For example, long working hours and night shifts can be recognized as fatigue exposure, while excessive workload and conflicting priorities can be categorized or recognized as cognitive and emotional load exposure. By formally recognizing the psychosocial hazards in job hazard analysis, in the risk registers, and the OHS documentation, organizations legitimize these risks and ensure they are visible to decision makers. This step is critical to moving psychosocial risk management out of the realm of informal concern and into structured industrial hygiene practice. Evaluation focuses on assessing the magnitude and significance of recognized hazards to determine risk level and prioritize for control. Psychosocial risk evaluation typically use a combination of qualitative and also semi-quantitative methods rather than direct exposure measurement. Key indicators include working hours, shift patterns, fatigue scores, absenteeism, incident timing, and also health data trends. Surveys and focus groups provide insight into perceived workload, stress, and support levels, while HR analytics can reveal patterns associated with psychosocial strain. In some contexts, technologies such as fatigue monitoring system or wearable devices may provide additional data, subject to ethical and privacy consideration. Evaluation should consider both likelihood and consequences, recognizing that psychosocial hazards often contribute to high consequences safety, even if they do not cause immediate illness. Linking psychosocial indicators with safety performance data strengthens the business case for intervention and supports evidence-based decision-making within the industrial hygiene framework. The hierarchy of control remains the cornerstones of effective industrial hygiene and can be adapted to many psychosocial hazards. Elimination and substitution are the most effective controls and may involve removing excessive workload, unrealistic deadlines, or unnecessary overtime. Engineering and design controls include optimizing shift schedules, improving task allocation, and using automation to reduce cognitive load. administrative control encompass policies, procedures, leadership training, fatigue management system, and clear role definition. Training in resilience or stress management, while sometimes useful, should be recognized as lower order control similar to PPE, as it plays responsibly on the individual rather than the system. And applying the hierarchy ensured that the psychosocial risk control focused on work design and organizational factors rather than solely on individual coping. This approach aligns with the preventive intent of industrial hygiene and delivers more sustainable risk reduction outcomes. The common psychosocial hazards in Indonesian mining operation include high job demand, fatigue, low role clarity, poor supervisory support, harsh leadership styles, and ineffective change management. Fatigue remains one of the most significant risks, rising from long shifts, insufficient rest periods, and extended commuting times. Low role clarity can occur where responsibilities between owner and contractor organization are not clearly defined, leading to confusions and stress. Poor support from supervisors, including inconsistent communication or lack of feedback, undermine trust and engagement. In some environments, aggressive or or authoritarian management approaches may normalize intimidation, discouraging workers from speaking up. Poorly management organizational change, such as restructuring or contract transitions, adds uncertainty and anxiety. These hazards interact and accumulate over time, increasing the likelihood of mental strain and unsafe behavior. Executives should ensure that these risks are explicitly recognized within risk assessment and addressed through systemic controls rather than individual resilience alone. Measuring psychological health and safety requires moving beyond traditional lag indicators to include meaningful leading indicators. Lagging indicators such as absenteeism, turnover, psychological injury claims, and incident rates provide insight into outcomes after harms has occurred. The leading indicators focus on the preventive activities and system health, including leadership capability, hazard reporting quality, workforce consultation, and training participation. Indonesian mining operation integrating HAC data with HR data provides a more complete picture of risk exposure and control effectiveness. Organizations should ensure that the metrics of the psychological health and safety are incorporated into regular performance reporting and reviewed alongside physical safety indicators. This data-driven approach enables early identification of emerging risks and support continuous improvement. In conclusion, psychological health and safety is not optional. It is essential for safe, resilient, and sustainable operation. And by integrating it into industrial hygiene, we protect not just workers, but the future of our industry. Thank you.